Hey guys, this is part 2 of our AP1 lab, and we're going to talk about vertebrae. So right here now you're seeing two vertebrae. They're cervical vertebrae. They're actually our first two. This is C1 and this is C2, and they have special names. This is the axis, this is the atlas, and this is the axis. Okay, so again, C1 is the atlas, very distinct looking, as you see here. And we'll talk about it more in a little bit. This is the axis, C2, and again, also distinct looking. Now I'm going to bring in real fast a C3 vertebra here, and this would basically look the same as a C3, 4, 5, or 6, or 7. Okay, so C3 to C7, basically, they all look the same. And so this would be your typical cervical vertebrae. So on the test, if we asked what type of vertebrae this is, you'd simply say cervical. If we pulled out one of these, you would say atlas, okay, even though it is technically a cervical as well. Okay, so going back to this one real fast, we'll talk about some of the structures. So this is the anterior part of any vertebrae, and it has what we call a vertebral body in it, okay? And basically the weight of your body is going to be on the bodies, the vertebral bodies. They kind of bear the weight. So you can picture a little disc here, and then another vertebrae, and then a disc, and another vertebrae, and same below. And so that kind of helps orient us. Anytime we see the body, we know it's anterior. Okay, on the posterior side, you always have this pointy structure called a spinous process. Okay, and this one unique thing about cervical vertebrae is that it has a bifid or forked spinous process. So that helps you identify cervical vertebrae. The biggest thing, though, about cervical vertebrae is simply that they are small. So that should help you identify cervical. The other unique thing about a cervical vertebrae is it has these holes on either side called transverse foramen. Okay, they're actually for the vertebral artery. And again, it's the only vertebrae that have a transverse foramen. If you look back at the atlas, it has a transverse foramen. Even the axis has transverse foramen. Okay. Now the axis we'll mention for a minute. It has all the structures of any vertebrae. It has a body. Okay, if I hold it right here. It's going to have other structures we'll talk about in a minute, but it has one unique thing you need to know, and it's this process called the dens or the odontoid process. Okay, you can call it the dens or the odontoid process. So that's unique. How would it sit? Sit just like this. Okay, so it'd sit under the atlas, and they would look just like that. And there's rotation that occurs between C1 and C2. You can kind of see how it would work there. Okay, what would sit on top of the atlas? Well, it would have to be the occipital bone, so it would have to be like this. The occipital bone would sit on top of the atlas. And yes, there's a joint there as well. Okay, so jumping back to this now, one thing the atlas is missing, as you can see here, is there's no vertebral body. So that's a very, very important thing to mention. But it has many of the other structures of the other vertebrae. So I'm going to pull back out here so we can talk about our typical cervical vertebrae. Some other structures you need to be familiar with, okay, that we'll note on here, and then we'll look at some other vertebrae, are the superior articular facets. They're also called superior articular processes. Okay, so basically the facet is simply the joint surface. Okay, basically one vertebrae would stack on top of the other and form a joint right here. These are the synovial joints. Okay, which means these are the joints that actually allow for movement. In case you're wondering, the disc which would sit here is strictly a shock absorber. Okay, so we call these superior articular facets. Okay, or superior, you could call them superior articular processes. That would be sufficient. These would be inferior, make sure I point to them here, inferior articular facets, right here, inferior articular facets. Okay, the transverse foramen I showed you a minute ago, they're right here. Okay, the transverse foramen, which is part of the transverse process. This is the transverse process. Okay, so Another structure I want to show you here is this piece of bone we call the lamina. Okay? If I was to cut the lamina here, the spinous process would essentially fall off. So that's a good way of looking at it. That's called the lamina. Now this is a small bone, so we want to show you some other bones. Let me go to the next vertebrae, the next regional vertebrae, and this would be the thoracic vertebrae. Quite a bit bigger. Notice quite a bit bigger vertebral body, okay? And that's an easy way of telling. It has much larger transverse processes, significantly larger transverse processes. It also has a spinous process which points straight down, or close to straight down. Okay, it's very sharp, pointed, and it points down. That makes it easy to identify as a thoracic vertebrae. Notice it still has superior articular facets, has inferior articular facets. Okay, where would the lamina be? The lamina would be right here. Okay, and right here. There's pieces of bone here. Where would the pedicle be? This is a new one now, a new structure. Pedicle is a piece of bone right here. And on the other side, it is right here. If I were to cut through the pedicles, the vertebral body would essentially fall off. Okay, so the pedicle basically attaches what we call the posterior arch to the vertebral body. Okay, big hole in the middle we call the vertebral foramen. That's going to be, basically those holes form the spinal canal, and of course that means the spinal cord would sit in the vertebral foramen. Okay, now some other vertebrae to look at. Now we have lumbar vertebrae. Obviously the very, very biggest of all the vertebrae because they're going to be down in the lower back. Very large vertebral body. Quite large spinous process, but notice it does not point down. It just points posteriorly. Okay? Strangely enough, it has small transverse processes. Pointy, blade-like, very small. Here are the superior articular facets. Here are the inferior articular facets. Here are the, I'll show you from this angle. Here is the pedicle, and here are the lamina. Here are the lamina, on this side of the lamina. And there's the vertebral foramen. That covers pretty much all the vertebrae, okay? And another thing to mention is we have on the list sacrum and coccyx. I don't have those handy to show you, but I want you to really honestly focus more on the vertebral types, okay? So just to show you kind of all of them there, these were the cervical vertebrae, thoracic, lumbar. Point it that way so you can get an idea of what they look like, okay? Now what we're going to do is we'll go ahead and switch these out, and we're going to talk about rib for a minute here. Okay, so here's a rib. You know, if we asked you to name the bone, it's as simple as saying a rib. Okay, so that seems too easy, but that's the name. The actual official name of this bone is a rib. Okay, there's only a few parts of the rib. Okay, you have what we call the blade, which is this basically region right here of the rib. Okay, you also have the head, the neck, and the tubercle. These three parts of the rib always attach to the vertebrae, which means these three parts of the rib are posterior structures. So if we had to visualize it on a person's body, okay, the vertebrae is back here, and ribs only attach to thoracic vertebrae, okay, just to let you know. It would have to attach something like this, okay? This is a thoracic vertebrae, so that would work, okay? Notice the head is attached to the body. The tubercle is attached to the transverse process. They're two separate joints, okay? And the blade would kind of move, you know, kind of run out like that, okay? So that's important because I'm going to show you something else here. Top of the rib is always smooth and curved. The inferior aspect of the rib is sharp and more pointed, as you'll see here. So that helps me identify, and this is going to be the first bone you need to know this, that helps me identify this as a left rib. If I were to try to attach it over here, it would be upside down. Wouldn't work. Okay, so this is a left rib, and you need to identify your lefts from your rights. Okay, so after a rib, we're going to jump to sternum. Okay, and this is your sternum here. Technically, we're looking at the anterior surface here of the sternum. Okay, notice it does have ribs attaching to it, just for, reference here. That makes this the anterior surface, and this is the superior part of the sternum. Okay, we call this section of the sternum, notice there is a joint right here, so this is the manubrium. Okay, that's the region of the sternum. This is the body, and this is the xiphoid process. Okay, those are three regions of the sternum. Okay, a couple other structures to be familiar with. We call this notch the suprasternal notch, and we call these two notches the clavicular notches. Notice right here, got a green dot on one of the clavicular notches. So that was an old test question. Okay. Another thing to make note of is this bump right here happens to be on the joint, and that's called the sternal angle. It's a bump that you can feel on your own sternum. And these spaces, we call these spaces between ribs intercostal spaces. Okay. So that would make this, because I know this is the anterior surface, that would make this the right side of my essentially rib cage, or right side of the sternum. This would be my left side of the sternum. Fairly self-explanatory. Okay, so that is sternum. Okay, I'm going to jump to another bone. Some students find this a little challenging, but it's not a bad bone at all. It's called the os coxae, or os coxa singular. Okay, so one of them would be os coxa, two of them os coxae. Okay, this would represent an adult bone because it's one bone. In a child, it would actually be three separate bones. Okay, so os coxa would really be a term for the adult bone. Okay, in a child, there would be growth plate in the socket here, which we'll talk about, separating the three parts of the individual bones. So we still want to identify the three, separate bones, okay, even though they're not present now. We want to identify this larger portion here as the ilium. So it's got this big wing. Okay, you can see it from this angle. This is the ilium. Okay, you can see here, it's got a red dot on it too. We call this region I'm holding the pubis, or pubic bone. And then we have here the ischium. Part I'm holding here, this region is the ischium. So those are the three regions of the os coxa: ilium, ischium, and pubis, or pubic bone. Most of you guys know the pubic bone is going to be anterior. Okay, so if I try to position this bone, I'm going to sit it anteriorly. Okay, I always want the socket to face out. We'll talk about what that's called in a minute. Right from, immediately from doing this, and the pubic bone's easy here because you can see the red dot, so we know that's got to sit anteriorly. Immediately I know this is a right os coxa. Okay, so we want to be able to identify that as a right. Okay, as far as structures go, we're going to go through them briefly here. Okay, so the ischial bone has an ischial tuberosity. It's a little roughened area where the hamstrings attach. We've got notches on the posterior side. We've got this big notch called the greater sciatic notch. We've got a smaller one called the lesser sciatic notch. So greater sciatic notch, lesser sciatic notch. Have a large foramen called the obturator foramen. Our socket is not called a socket, but actually called acetabulum. The acetabulum. It's a specific name to this socket, which would technically be the hip joint. Okay, so the acetabulum is the socket for the hip joint. Okay, we have, now I'm going to kind of position it back in place again here. We have these two structures called spines. We call this the anterior superior iliac spine, anterior inferior iliac spine. Notice they're anterior because they're facing the same side as the pubic bone. If I go to the back, posterior side, this is the posterior superior iliac spine and posterior inferior iliac spine. Okay, mouthful, but it makes sense. The wording makes sense. Okay, we call this the iliac crest, and we call this the iliac fossa. You can see it is a depression. And those are all the structures of the os coxa. Now we're going to grab another bone. We're going to grab the clavicle. Okay, clavicle is a unique bone. It's S-shaped. And not many structures on the clavicle to identify, but we're going to kind of go through some of the tricky parts. Trickiest part probably of the clavicle is just figuring out, you know, is it a left clavicle, is it a right clavicle? And there are some little tricks to figuring out what's what. And so we'll go through that. Let me show you the quick structures first. So this is the sternal end, and the sternal end of the clavicle, they've got it identified here, is basically round. So you can see that's the sternal end, which means it's going to attach to the sternum. If you want to kind of see where it attach, it's more or less going to attach to the sternum. Right there. Okay. There is a structure that is inferior, right, on the underside, and posterior, and this is called the conoid tubercle. Not the coronoid, but the conoid tubercle. I want to make sure when I'm figuring out, you know, sides, I want to put this, just like I said, inferior and posterior. This end, also identified here, is the acromial end, okay, which is going to be attached to the acromion of the scapula. So I'm actually positioning it, you know, kind of reference to my own body. And so this would be, based on that, this would be a left clavicle. Okay. And that's, again, all you need to know for the clavicle. Okay. Switch bones again and grab the next bone. This bone is called the scapula. We know it as a shoulder blade, but again, official term is going to be the scapula. We're also going to identify left and right. We're going to go over some of the landmarks first. Just to give you kind of rough guideline, this is superior. This little point would be inferior. We call it the inferior angle. Again, this is the socket, which is always going to be lateral. So that socket, in other words, has to face out. Okay? So that helps me position it, and you kind of, from me doing that, you can probably figure out that this is a left just for me doing that. Okay? But let me show you the landmarks here. So we've got this one highlighted right here, which is called the acromion. Sometimes you see it written as acromion process. Either one is correct. Okay? We call, on the posterior side here, we call this the spine. Okay? Flipping back to the anterior again, we call this the coracoid process, not coronoid, but coracoid process. We call our socket, which if you notice is very shallow, we call it the glenoid cavity or glenoid fossa. On the anterior side, again, you'll notice it's smooth. There is a fossa here, we call it the subscapular fossa. If I flip to the posterior side, we call this the supraspinous fossa, and this the infraspinous fossa. Okay? There is a notch here, as you'll notice. We call this the suprascapular notch. Okay? And then there's some angles and borders. We talked about angle here. Actually, this one here I'll do first. This is the inferior angle. That would make this the superior angle. This is the medial border, and this is the lateral border. Again, if I know my landmarks, I would put this as a left scapula. Okay? And I can continue here. We'll go ahead and grab our humerus. So this is the humerus bone. Okay? And we'll go over some landmarks and then tell you what side this is. So right off the bat, we call this the head. Now you can imagine that the head is going to fit right in the socket here. It's a very shallow socket. Okay, so this is the head of the humerus, or head. Has this little line around it. It's actually around the head if you just kind of trace the line. We call that the anatomical neck. It's just a faint line around the head of the humerus. Okay? They call what I'm grabbing here the surgical neck. So it's slightly different. Okay, so surgical neck versus the anatomical neck. We have the greater tubercle here, highlighted in green, and we have the lesser tubercle. Might be hard to see on the video, but this one is larger than this one. So greater tubercle, lesser tubercle, and we call this groove the intertubercular sulcus. Literally means between the two tubercles. So intertubercular sulcus. Okay. Book also calls it intertubercular groove. So either one is correct. Okay. Now, some other important landmarks. Got this large bump right here. That's always going to face medially. Okay. We call that the medial epicondyle. Okay. This small bump over here is called the lateral epicondyle. Okay. And that's important because that's going to help us identify left and right. We have this round structure here called the capitulum, and we have this hourglass looking landmark here called the trochlea, and these are part of the joint space. Okay, so capitulum and trochlea. Okay, and if you picture it, and I'm going to put this on my own arm here so you can see, it's going to sit on my arm like this. So the radius is going to, you can visualize the radius sitting here, the ulna sitting here. Radius is always the lateral bone, ulna is always the medial bone. So we call this, go back here, we call this fossa here, you can see it in pink, that's the radial fossa. Okay, it's very small, but it's just a little indentation for the radius. Okay, we call this the coronoid fossa. Okay, notice both of these are fairly small. Now, if I show you the posterior side, we call that the olecranon fossa. So this helps you identify the fact that this is the posterior side of the bone because it's got the larger fossa in it. Okay, so that just confirms that this is the anterior side. Okay, again, this is medial, and then this would be lateral side. Okay, because there's my lateral epicondyle. So that helps me identify that this little roughened area right here is the deltoid tuberosity. Right, because I know it's a little roughened area here on the lateral side. Okay, so those are all the structures of the humerus. I think I showed you on my own arm that this has to be a left humerus. Okay. Now, if you want to visualize what that looks like, how it would attach, you can look here at the ulna. Okay. This is the ulna here, and the ulna really gives you the hinge action of the elbow. Okay. So we're going to look at the ulna next. You can see how it attaches there to the humerus. Okay. The ulna is always going to sit on the medial side. I'm going to bring my arm in here. Medial side of the forearm. Okay. And I'll give you some ways of knowing, how it's supposed to sit. It is a left ulna. But first off, you've got this big notch here. We call that the trochlear notch. You always want that trochlear notch facing superior or anterior, depending on how your arm is. Easy way of putting it, lay terms, up. Okay, so you want the ulna facing up, this notch, trochlear notch facing up. We call this the coronoid process. If you think back, studying, you're being a good student, you're studying, you probably recognize that the coronoid process is also a process on the mandible. Same name, same spelling, different structures. So again, I can't tell you why anatomists did that, but they named it the same thing. So that's called the coronoid process. We call this large process the olecranon process. Okay? And we call this, to where you can see that, the radial notch. That's probably the biggest help for helping you find what side, because if my ulna is facing the correct way, upright, my trochlear notch is up, I then need to figure out, well, does it go on the left side of or the right side, and this radial notch is going to have to butt up against the radius. And it can only do that on the left side of my arm. Okay, so that makes this a left ulna. Okay, thanks to this radial notch. Another structure is the head, and another structure is the styloid process. Now you're going to say, I remember styloid already. We had a styloid process in the skull. Well, you're seeing another styloid process here. Okay, and again, that is the head of the ulna. Okay, so those are all the structures for the ulna. Now I'm going to show you its other bone here. Okay, and of course this is the radius. Okay, radius is the laterally most bone, if you want to put it that way. How would the radius attach to the humerus? It's going to attach like this. What does the radius do? It will flex and extend, right? Kind of along with the ulna, but its big action is it gives you the ability to pronate and supinate. Okay, that's what it's helping you do, is pronate and supinate. Okay, so with the radius here, and I'm just going to show you my own arm, it happens to be a left radius, and I'm going to show you why that is here in a minute. Best way to start the radius out is by putting this structure in the superior position, and it is highlighted in green here. This is the radial tuberosity. Okay. Right above it is the neck, and above that is the head. So head, neck, and radial tuberosity. Okay. It also has a styloid process, and it also has an ulnar notch. So the styloid process is going to have to sit on the lateral side of my arm. Just like with the ulna, this notch is going to have to butt up against it. So the only way that's going to happen is in this position, okay, on the left side. So that makes this a left radius. Okay. So obviously we have our attachment for the humerus right here. The distal attachment is going to be to the carpal bones. Okay. And so we'll go ahead and cut this and do another video for carpals.